Hello everyone, I'm Alex Jewell, a junior biomedical engineering student here at Rowan University, where me and my three colleagues, Sarah, Andreas, and Olivia, are looking to innovate in a delivery strategy for percutaneous fixation of bone marrow lesion procedures. Now we're going to hand things over to Olivia to give a background explanation of our project. Psych guys, it's not Olivia, it's me again to give you a background of our project. So what a bone marrow lesion essentially is when this damage to a subchondral bone and subsequent deterioration of the overlying articular cartilage is a major contributor to pain and osteoarthritis, which affects approximately 25% of the U.S. population. Often due to osteoarthritis, something forms called a bone marrow lesion. And a bone marrow lesion is when a healthy bone starts to break down and become more porous than a healthy bone. And the two major surgeries that are used to correct a bone marrow lesion, there is the total knee replacement, which is very invasive and requires the opening up of a joint of a knee or an elbow and replacement with a metal implant. And then, of course, you have complications that arise afterwards, such as foreign body reactions. The other treatment method is something called a subchondroplasty. And this is when a surgeon injects a calcium phosphate based bone substitute material into the bone marrow lesion to stop deterioration. Often, though, during this surgery, there is under or overfilling of the site, which is estimated to occur in 30% of injections. This can result in further progression of the disease or pain in the patient. To counteract under or overfilling of the site, we've designed a device that consists of a capacitive force sensor within a 3D printed clip that asphyxiates to the top of the bone filling syringe between the plunger and the surgeon's thumb. This sensor is then connected to a circuit board with 3 LEDs that is powered by 2 lithium batteries. The LEDs provide real-time feedback for the surgeon when pressures have exceeded predetermined levels, indicating risky injection speeds or overfilling of the BML procedures. In this procedure, a surgeon drills a cannula into the area of the bone defect, which is then delivered with the serum Acufil, which is a calcium phosphate mineral compound. The bone substitute material hardens and mimics the properties of cannulous bone and eventually is reabsorbed and replaced with new bone. This surgery is very advantageous for the patient as it is much less invasive than total knee replacement. It also has a much shorter recovery time and is 1/10 of the cost.
Our project incorporates two proposed solutions to aid the surgeon during the PFBML procedure. The first part of the project is a device that attaches to the syringe and measures the force applied to it by the surgeon. Using LED lights, it provides feedback to the surgeon half a second before they feel pushback. The second part of the project involves using volume rendering software to measure the volume of bone marrow lesions. With this information, the surgeon will know how much to inject before performing the surgery.
Now I'm going to discuss the current prototype design. Our current prototype design utilizes a capacitive force sensor and a printed circuit board that is able to integrate with current procedures. The picture on the right is a 3D printed clip that is placed over the top of a plunger or a syringe. There's a capacitive force sensor within the clip that measures the force applied by the surgeon's thumb. Then the picture on the left shows the entire prototype. The capacitive force sensor is connected to the PCB by jumper wires. The PCB is powered by 2 lithium batteries, and then there are 3 LEDs that provide feedback to the surgeon. Green tells the surgeon to keep injecting, yellow tells the surgeon to slow their injection rate, and red tells the surgeon to stop injecting and that the lesion is full. Alright guys, it's your boy Alex here again, where we're going to talk a little bit about a feedback test that we performed. To test our device, we created a model of fluid injection that goes into a bone marrow lesion to simulate filling and feedback. We told the person injecting to stop when they felt pushback on the plunger syringe, and our data is presented in a force versus time graph on the slide. There's an initial increase in the force to overcome the static friction of the syringe. After this, the force applied plateaus. Eventually, the lesion becomes full, and there's an increase in force applied in order to continue injecting. This data shows that the capacitive force sensor is able to detect an increase in force before the surgeon can feel it. We have an IRB approval and will be using this prototype to gather surgical data over the summer. Alright guys, it's still me, and now I'm going to describe the volume rendering portion of our project. So to detail the volume rendering portion of our project, here we are trying to use common DICOM analyzing software such as Osiris and ITK Snap to auto-segmentate MRI scans of bone marrow lesions. And from this, we produce a 3D rendering of the lesion, which could in turn predict the volume of serum needed during surgery. So the auto segmentation is done by selecting a specific exposure wavelength to be a threshold. Then the software automatically highlights all the areas on the scan that match the threshold. Some human corrections are required, but the process is short and sweet, producing a 3D rendering in under 30 minutes. We have currently done this process for 3 MRI scans, with one predicted value coming within a 100th of a milliliter of the actual volume of serum used in the surgery. We hope to continue this process as we accumulate more MRI scans from the surgeon assisting our project, Dr. Sean McMillan.
Moving forward, we are looking to complete the device prototype and give it to Dr. McMillan to record more force data during operations. We can then use this data to calibrate the LEDs based on the force measured and patient outcomes. Additionally, we are waiting for more MRI scans of bone marrow lesions from Dr. McMillan. With these, we can render more volumes of the lesions to more accurately differentiate lesion tissue from healthy bone and get more accurate volume measurements.